Welcome back. I'm joined now by Dr. Bruce Scott, president of the American Medical Association. He's joining us from Louisville, Kentucky. Welcome, Dr. Scott.
Well, thank you. It's a real pleasure to be with you this morning.
It's wonderful to have you. I think most people have heard of the AMA, but many may not understand the role of the organization. I think, in the simplest terms, you're kind of a lobbyist organization. Is that right? But the AMA means a lot more to people than just the role of a lobbyist.
Well, the AMA is a lot more than just a lobbying organization. We are the largest and most influential association of physicians all across America. We convene representatives of every state and of every specialty twice a year in order to develop policies that are in the best interest of our profession, but most importantly, the best interest of our patients. So we're obviously active within Washington, D.C., and we work with the state associations, including the Florida Medical Association, which is a very important partner of ours within the states. But we're also active within the court system to protect patients and physicians' rights. We're active in education. We also are a credentialing organization that works with the different credentialing organizations, and we're a convener of physicians. So we are interested in promoting the art and science of medicine, and advancing public health is actually our mission.
And are there things that people would recognize that the AMA has done, either laws that it's helped change or court cases that it's brought that have affected patients or doctors in a way that a layperson would recognize?
Well, something very basic. The American Medical Association years ago was the group that was fighting the large tobacco industries to do things in the interest of public health, to get rid of smoking in public places, on elevators and such. We're also very instrumental, believe it or not, in simple things that affect people every day, like seatbelts in their cars, all in the interest of public health. So the AMA has been active since 1847. Actually, our founding was based upon combating quackery and misinformation that was spreading years ago among the patients in America. And we've stood by that ethical code ever since then, supporting the art and science of medicine.
And so the AMA is kind of a member organization to make sure that the people who are involved in providing health care are credentialed, legitimate, not quacks, as you say. Um, does the group get involved in political issues? I mean, there's so much about medicine, about science that has become, unfortunately, politicized. Um, how does the AMA navigate those waters?
Well, let me be clear that the AMA is a nonpartisan organization, and we don't give endorsements or promotion for any particular candidate in any race, including, for example, the upcoming presidential election. But that said, when you ask, are we involved in politics? Absolutely. We're involved in advocacy for physicians, for healthcare in general, and for our patients in Washington, D.C. We're very active in Washington, D.C., because there are so many issues that face medicine right now that need federal legislation to be enacted to address these issues that unfortunately seem to be kicked down the road by politicians too many times. And it's important for them to act, because these are the issues that are impacting patients every single day.
So, what are some of your priority issues at present?
Well, the number one issue right now is Medicare and Medicare reimbursement. Believe it or not, Medicare reimbursement in 2024 is 29% less than what we were paid in 2001 when you adjust for inflation. So physician practices, just like all of your listeners, have faced high levels of inflation these last number of years, and yet Medicare is paying us less every year. This in 2024, we received almost a 2% cut in what Medicare paid us for the same services provided years ago. And over the course of these years, the cuts have added up to the point that it's now having impact all across healthcare. And the impact in many cases is access. So Medicare patients in particular are elderly, our most vulnerable patients, those with chronic disease, are having trouble finding a physician because so many physician practices financially can't make it anymore. And this is one of those issues that we can't kick down the can anymore. We need federal legislation to fix Medicare now. If not, I'm really worried about access is going to become more and more of a problem for all of the patients.
And we should be clear, most people understand what Medicare is and how it works, but that is federally financed healthcare for elderly patients, older patients, senior citizens. And the reimbursement that you're talking about is how much the government pays physicians for the work that they do, whether it's seeing a patient or performing some sort of surgery.
That's exactly right. It also takes care of people who are disabled and have chronic diseases and such, but it extends way beyond just those patients because you see, in most every community, the contracts from the private payers are based upon the Medicare rate. So they pay a percentage of Medicare. So when the rate of Medicare reimbursement goes down, the reimbursement for all of your private payers goes down as well. And as a result, a recent study by the American Medical Association showed that 1 in 5 physicians are looking to retire or close their practice within the next 2 years. And we already have a shortage of physicians, and patients are already having difficulty getting appointments to see doctors, particularly new Medicare patients trying to find a primary care doctor or a specialist. And that situation is just going to get worse unless the federal government acts.
And so doctors, when they're faced with this, they're not getting reimbursed essentially what it costs them to provide that service. And you're advocating for those reimbursement rates to be increased. Who's fighting that? Like, who is against that improvement in the reimbursement rate or a more accurate reimbursement rate?
Well, getting anything accomplished in Washington, D.C. is difficult right now, but particularly when it has dollar signs attached to it. And admittedly, it's going to cost a lot of money to provide more resources, more reimbursement to physicians by the federal government. It's going to cost more money. But if we can send billions of dollars overseas, we ought to be able to find money in order to make sure that we can guarantee the care that our senior citizens deserve, care that they have paid into a system through their entire life with the promise that the care was going to be there for them when they became of need for that care. So we need to live up to that promise, and we need our legislators to do what they know needs to be done. You see, part of the challenge is that there's a lag time, and physicians, to train a new physician, takes about 7 years minimum, 4 years of medical school and a minimum of 3 years of residency. So we can't afford to lose even one more physician today because we don't have time to replace them with a new physician for the future.
When you talk about reimbursement rates, I mean, there's the federal reimbursement, but then there's also the question, as you said, the insurance rate, how they reimburse doctors, very often based on that federal reimbursement rate. Locally here in Jacksonville and the First Coast, we've had a couple of really high profile disputes between insurance companies and providers. There's a dispute that was recently resolved between Florida Blue and Baptist Health here. And then there's also an ongoing dispute between United Healthcare and the University of Florida Jacksonville Hospital and their patients. And it has impacted some local, people who were previously covered as part of this one deal, and now learning that they're not going to have their primary care physician any longer, that will not be an in-network covered um, doctor, and they're really going to have to scramble to find a new physician. Is that part of a larger trend that you're seeing in terms of disputes between providers and insurance companies over this kind of reimbursement schedule?
Absolutely. As the margins get thinner, the challenges get greater. I can tell you that in my market, that the largest private payer, they control 60% of the market here. They offered us rates recently in a contract that were less than what they paid us 7 years ago. And anybody who's been to the grocery store or the gas station knows that prices are a lot higher now than they were 7 years ago. And we tried to negotiate with them. And after months, they finally came to the table and gave us about a 2% increase. And one of the challenges is I'm in an independent private practice. And so each month, it seems like my rent goes up, my expenses go up. My staff, they need raises because they're facing those same realities at the gas pump and the grocery store. And I just simply don't have the money to give them. And we didn't really have a good choice. This is the situation with contracting, is that they control 60% of the market. If my practice says no to the contract, my patients lose out. And if we say yes to the contract, financially, it's going to be more and more difficult to be sustained. A few months ago, there was a cyber attack on a intermediate who helped physicians file for bills. And for about 6 weeks, we didn't receive income from the services that we provided. And my practice had to take out a loan. That's how close to the margin we are in order to be able to pay my salaries and be able to pay the rent and our other due expenses. So I don't know the specifics of the dispute down there in Florida, but this is not a unique situation. And physicians are making difficult choices. Do we employ less staff? Do we not update our equipment? Do we stop seeing patients altogether? Do we limit the number of Medicare patients that we see? Do we stop accepting new Medicare patients? And unfortunately, in some cases, physicians are giving up. And that just leads to more access problems for the patients.
I mean, I think it's really extraordinary. The president of the American Medical Association having to take out a loan because of those delays and that contractual. Well, actually, that was just I guess, a hack. But the fact that that is so disruptive because the margins are so close. And you are a practicing physician. Does that give you a different perspective running the AMA than perhaps than it might someone else?
Well, as a active practicing physician in a small practice, I live the issues every day that we as physicians face. We have this declining reimbursement, a spiral down, and at the same time, it seems that more and more administrative burdens are piled upon us every year. More and more hassles in terms of prior authorization to try to get the care that our patients need, that we together decide that is the right thing for the patient. And then we have to justify that with an insurance representative, many times who's not been to medical school, and rarely are they an otolaryngologist. And heck, I jokingly say that sometimes they can't even pronounce otolaryngology, but they're supposed to be the person making the decision. The decision without seeing the patient, without doing an examination, without talking to the patient. And yet they control the money, so they make the decisions, and it's ultimately, again, the patients that suffer.
Can you think of an example in your own practice where you've encountered something like that, where they're waiting for a prior authorization before you're proceeding with something that you think is a medically necessary procedure?
Well, it's easy to think of an example. I can give you an example, and most physicians could probably from every day. But about 3 or 4 weeks ago, I saw a lady who had a tumor growing in her maxillary sinus right here in the middle of her face, right below her eye. And the tumor was growing and already beginning to erode into her eye. So I examined her, scoped her, and we talked about the options. And the best option for her was a surgical procedure. And it's a large surgical procedure to remove that tumor and hopefully save her eye. And after discussion, she decided that she wanted to proceed with the surgery. Now, she had some things she had to take care of first and put some orders in place. And we agreed to do the surgery about 2 weeks later. About 1 week later, she gets a letter from her insurance company, and I get the same letter that says that the procedure was denied because it was, quote, not medically necessary, unquote, going on to say that it was because she'd not been on an antibiotic and a steroid nasal spray. Now, even the lay people listening understand that an antibiotic and a nose spray that you can buy over the counter is not going to cure her tumor. So I got on the phone and I talked to the medical director, and after the peer-to-peer review, he agreed, and we did the surgery, and I'm happy to tell you that she did well. But let me tell you about the patient's perspective. I called her and I said, we've gotten the surgery approved. And she paused and she said, I don't understand. I trusted you, Dr. Scott. You told me I needed this big operation, and my insurance company says that all that I need is an over-the-counter nose spray. I explained to her the truth of the situation, and she understood. But imagine those days of stress, that anxiety that placed upon that patient when she was questioning the decision that she and her trusted physician had made. It's just wrong. And this is just one example that I could give you dozens more examples of.
There is an amendment on the ballot in Florida in November to do with abortion. It would basically restore the pre-Dobbs status of, a woman has a right to an abortion up to the point of viability under the direction of her medical advisor. Um, does the AMA have a position on abortion and abortion access?
I'm not familiar with the specific, I think you said a constitutional amendment or the specific legislation that you're speaking of, but I will discuss the fact that a foundational issue for healthcare is the relationship between a physician and a patient. And AMA strongly believes that government interference in whatever form into the relationship between a patient and their physician, and that relationship is wrong. And we should not allow that sort of intervention. When a physician is providing evidence-based, scientifically proven care to their patient, those decisions should be made between the patient and the physician. And that is clearly the policy of the American Medical Association.
Does the AMA have any concerns about the training of physicians in places where there currently is, abortion is restricted or very limited?
Well, the training program accreditation is done through a different organization than the American Medical Association. I know that they're looking at that and trying to find ways for physicians in those areas or training students and residents in those areas to be trained appropriately in the full band of reproductive health care and all of those sort of issues. So they're working through that, but it's a challenge.
I want to ask you just about, trust of the medical system. I think that came into question, particularly in the pandemic era and post-COVID. How does the AMA address what is perhaps an erosion of trust, not just in, medicine, but science more generally?
There has been an erosion in trust in general, not just in science, but where it impacts us. I said earlier that we are founded to promote the art of science, of medicine, and it is crucial that patients in particular trust their individual doctors. Now, we also want to restore the trust in physicians as a whole. And one of the issues that we've had to face is that some of the misinformation and disinformation that's been out there that has resulted in the distrust and questioning of science has been propagated by a small group of physicians. And one of the things AMA has been doing is working with legislatures and with licensure boards to discipline those physicians, to get physicians to live up to their ethical duty to provide scientifically valid information to patients. And the AMA was founded based upon combating quackery, and the difference between the snake oil salesman of 1847 and the disinformation of 2022 through 2024 has been social media. The way that it can spread so rapidly to such a large group of people. And it's amazing to me sometimes that people trust what they see on their phone or their tablet more than they trust what they're being told by their trusted physician, the physician who has been making important decisions with them for years. And we need to work to restore that trust, but I strongly encourage your listeners to trust in their individual physician and work with their individual physicians to ask questions and make sure that they're getting appropriate care. One of the deleterious effects of this whole thing that is now being felt, for example, is the politicization of vaccination has resulted in the return of measles. In Kentucky and up in Indiana, just above us, we have a measles outbreak, a condition that was largely controlled by vaccination. But because of the spillover of the distrust in the COVID vaccine, many parents are questioning whether their child needs to get the measles vaccination, which has been around since before I was a child. So we need to restore that trust.
Just briefly, I understand that it was actually an injury that you suffered that got you into medicine in the first place. Is that correct?
Well, it didn't directly get me into medicine, but I guess it sparked my interest. when I was a teenager, a young teenager, my brother and I, who actually, John Scott, lives in the Jacksonville area. He is an anesthesiologist down there. And he and I were in the garage and we were working on model airplanes. And I was climbing up to grab something that I needed and I fell and I grabbed for whatever I could grab to stop my fall. And a hook went all the way through my hand. So subsequently, I had to have a surgical procedure to restore the function of my hand. And well, I'm happy to tell you that I'm a surgeon today with full use of my hand. So, I recognize the ability of a surgeon, of a physician, to change my life, to restore something that was so essential to me. And I recognize that to this day, physicians change our patients' lives every day. And that is a sacred trust and something really special that physicians gain when we're able to help a patient. Patients send me letters or send appreciation to me, and they thank me for what I do for them, but I thank them for what they do for me, for restoring my hope that we can continue to help patients and cure illness and hopefully restore lives.
Well, he's Dr. Bruce Scott, president of the American Medical Association. Dr. Scott, thanks so much for joining us today.
It's been my pleasure to be here with you, and thank you for helping spread the word about these important issues.
We'll be right back in just a moment.